the ones that are already present, we can, and because Carolina was going to be the first, but if she's not yet, then we can move her to the end.
Okay, so yeah, let's start. Okay, so welcome everyone. We are here again. This is the second session of the introduction to directed acyclic graphs for causal inference. And Priscilla Mulakeri and myself, Ione Avila Palencia, are going to lead this session. And mainly this session, the idea is that we are going to discuss some of the DAGs that we receive. And specifically, the DAGs that we are going to discuss are the DAG done by Carolina Perez, then the DAG done by Yenisei Ramirez, and then the DAG done by Cecilia Anza and Xavier Del Clos. So the idea is that the first two ones, Carolina and Yenisei, are going to be led by Priscilla, and the second one, Ceci and Xavi, are going to be led by me. But of course, any of us are going to give comments, and of course, any of you, feel free to unmute, ask questions, give comments, because the idea is to have a discussion in those DAGs. So we have 2 hours and 4 DAGs. So the idea is that we are going to spend between 25 minutes, 30 minutes per DAG. And I think that's it. Do you want to add anything, Priscilla?
No, I just...
Is the session being recorded? Because several people from my team are not able to come. So,
yes,
okay,
yes,
great.
sorry, I didn't say that. Yeah, this session is recording right now, and this is going to be available in SALURBAL website. I don't know exactly when, but soon.
That's great, thank you.
Okay, so should I stop sharing my screen? You start, Priscilla?
Okay.
Okay.
Can you see my screen?
Yes.
So has Carolina joined the call? Because this is her DAG, but I can change to another one if she's not here yet.
Yeah, I think she's not here yet.
Okay. So I'm gonna paste. I'm gonna paste the next one, which is so good afternoon, everyone, people who are joining in now. Just one thing that I wanted to add is that this is just a very first look at the first draft of your DAG. And you're almost sure not getting out of this session today with a ready DAG, but the purpose of today is to discuss how we could potentially improve and the next steps that you can take in order to clarify your research question using a DAG for that.
Priscilla, sorry to interrupt. I received a message from Carolina that she's coming. But anyway, maybe you can just keep going with Yenisei, but she will be here soon.
Okay. So I thought that since we have plenty of time to discuss each one, we could potentially go let the owners of the DAG speak a little bit about their research questions and their variables, so that we all can be on the same place when discussing it. So Yenisei, would you like to talk a little bit about your DAG, your research question, and maybe how the levels in which you are measuring some of these things?
Yes, of course. Well, this is a proposal. Well, this is just one of my 2 proposals, because the other one, it's like more descriptive. So I think that I don't know how to do a DAG with that. So, well, this is the, I will evaluate the association between the urban food environment and the body mass index of children and adolescents. This association is, well, we want to, well, to evaluate this association longitudinal. So we will have repeated measures from food stores and from BMI of the children and adolescents. So the outcome in this association is BMI C-score of children and adolescents, and exposure is food stores. We use 3 categories. One of them is the unhealthy food stores. The other one are healthy food stores, and the other one is supermarkets. So in this DAG, well, the literature explains that maybe this association could be explained by the, well, by if, well, I just need to explain that BMI is at the individual level and food stores it's at the municipality level. So yes. So, and the first one that I need to explain this, it's that I put 2 variables, food inadequate diet and food purchase, because some literature explain that this could be a way, or well, it's not a casual way, but this is an explanation because maybe some neighborhoods that it's full of some food store like convenience stores and other ones that sells processed and ultra processed foods could be, well, could influence on the diet of the person, of the people, and maybe on the food purchase too. And this could explain the association with BMI, with an increase on BMI or a decrease or a maintain in BMI of children and adolescents. And then we have some covariates that we think that are, well, the literature are explained that are confounders. One of them are the parents' education, and the other one could be the household socioeconomic status level, and then municipality socioeconomic deprivation, which in Mexico is, we will use the marginality index, which is a measure that could explain how an area, in this case, the municipality, who has, well, yeah, it's more deprived, it's a lower socioeconomic level, and less deprived, it's a higher socioeconomic level. And then we added to this DAG other covariates like individual age and sex of the children. But I could review too that maybe the preferences, well, maybe these individual age and sex characteristics of the children could influence on the preferences, and these preferences could explain where they are more exposure or where they put, well, purchase food. And these two individual age and sex characteristics could explain to the BMI of these children. And there are other covariates like the population density and the geographic region, and maybe some other like the global trade liberalization that could influence the change on the food stores. But this one we don't have. So, well, we don't have these. These covariates are on measures. So I put them as a latent or unobserved variables. And then the minimal sufficient adjustment sets, I put it on an adjusted covariates, and Those are the household socioeconomic level, the individual age and sex, municipalities' economic deprivation, and the parents' education. And well, this is all my DAG. I think that maybe this could be another covariates that could influence this association, but at the moment, this is the way that I could explain my project. So I don't know if you have any questions or any comments. I will appreciate it.
Thank you, Yanesi.
Thank you.
Well, I really like your DAG. I like the fact that most people that designed the DAG, they thought about this sort of mediation. They thought about the mechanism, the causal mechanism, right? So you're thinking here. So basically, your main causal mechanism is you're thinking that high density of low quality food stores, I'm imagining,
yes,
leads to inadequate diet, that leads to higher BMI. A few things that I would say, first are like more general things in terms of your exposure. So you're talking here about food stores. I would try to define that better, in the sense that describe whether this is at the neighborhood level and what kind of measure you're going to use. So I think you mentioned you're going to use proportion of supermarkets, healthy and unhealthy food. And so I would try to define it in the sense that you're thinking, what is the sort of causal association that you're going to see with BMI? So if you are going to mix healthy and unhealthy food stores, then that might not be ideal, because then you're going to have a mix of effects, right? Because one is, according to your mechanism, one is more likely to lead to healthy food purchase, and the other one is more likely to lead to unhealthy food purchases. So you maybe want to create an indicator that says proportion of unhealthy food environments, or look at the literature to see if there is something that you could better define your exposure.
Yeah.
And yeah, so do you have, were you going to say something about that?
No, well, at the moment we just propose to use that, like the proportion, maybe the supermarkets per all the food stores at the moment. So I don't know.
Okay, because yeah, so that's really like, even thinking beyond the DAG, it's something that you should think about, because from the mechanism you are showing here, you're saying that food stores are likely to lead to inadequate diet. So I'm thinking that those food stores will probably food stores that sell more unhealthy foods, or the kinds of foods that are sold in food stores. Or maybe if you think that all kinds of food stores, they mostly have unhealthy food, or they're going to have some type of unhealthy food, then it might not matter what kind of store it is. But it's something that you had to define better in your research question.
Yeah, right. Thank you.
And so another thing that I think would be very interesting in this DAG would be to think about different levels, right? Because I think the indicator of food store is, you said it's at the neighborhood level?
No, at the municipality level. I think that at SALURBAL, it's the L2 level.
Okay.
Yes.
So I think that so you have the municipal, one suggestion would be to think about all of the sort of covariates that are at the municipal level that sort of lead to, there is an arrow between those variables and food store at this municipal level, and then at the same arrows coming out of that same variable. So if you think that municipal socioeconomic deprivation is something that's going to lead to higher density of food stores in those neighborhoods, and also going to lead to BMI, high BMI, independent of this direct association, right? So you would need to control for that, but you have to think about what kind of variables are here. If it's just municipal socioeconomic deprivation, it's fine. But as long as the variables are sort of at the same level that you're measuring, right?
Yeah.
So maybe you have other variables that are at the municipal level that you also want to measure that also confound this association.
No.
Or maybe
no. Maybe I need to add more that could be some covariates, but I think that with my data I will not have other ones. Well, maybe the population density could be there, right? As a covariate at the municipality level.
Yes, this is sort of a second suggestion that I have in terms of your DAG, is that you put population density here, which makes sense. The population density would have an effect on the density of food stores, right? Because the more people, I would expect to have more food stores, but also to think about how this population density would affect your exposure. Because in your DAG, you only want things that are associated with both the exposure and the outcome. So this, as a first DAG, you're thinking about everything that is sort of associated with everything, but on a second version, you should think about how can I clean this DAG and just think about the things that are associated with both, right? So for example, when you look at geographic region, right? So you can think that geographic region has association with the density of food stores, because in some regions I have more plantations of something, or I have more of some foods, or I have less of other foods. But you also have to think about how geographic region could have an association with BMI in order to put geographic region here.
Yeah.
Right? Because I only care about the things that are associated with both. I don't care about those other things. There is one type of analysis that we use in causal inference that's called instrumental variable, that these kinds of variables that are associated only with the exposure are very important, but we are not talking about instrumental variable here, we are just adjusting for confounders. So you want to think about the things that are associated with both.
Okay, yeah, maybe I need to modify those ones, because in this moment, I think that maybe geographic region, maybe here in Mexico, we have some regions like the north, where we can have, where we can have more prevalence of BMI. Maybe this could be the link.
Yeah,
between...
I would like to add something.
Yes.
I think here in terms of food stores, I personally would think not population density. I would think about many different built environment factors, because it's not only about density, it's also if you have a more sprawl city, it's quite likely, or you have more fragmented city, it's more likely that you will have less access to certain food stores, for example. And also a lot of built environment variables have been associated to BMI and to physical activity, which actually I don't see physical activity here, but maybe
no, I don't know.
For
I didn't add it.
This question. But yeah, so I think maybe built environment in general, or if you want to focus in certain factors of built environment, are variables that are associated with food stores and with your outcome BMI. And then I have one question. I mean, when you include here geographic region, what is exactly the construct that you are trying to represent with this variable?
It's just well, there is Mexico, and we can divide Mexico into 4 regions. One of them are the north region. The other one is south, Mexico City, and yeah, I forgot the other ones. And center, yeah. Okay. So, and these regions are like kind of different in terms of economic, in terms of some prevalences of diseases, maybe in this case BMI, I think that, well, BMI, we have the highest prevalence at the north region and at the south. So we could find differences between the regions of Mexico.
So I think, and I don't know if you agree, Priscilla, but I think in this case, geographic region is like a big ancestor of many of the different factors of your research question, right? Because you are like thinking the fact that you will have physical differences, but also social differences, and maybe things that are linked to historical differences, for example, or geographical differences because of the, I don't know, the specific geography of the place.
Cultural, I think cultural differences.
Yeah, exactly, or cultural differences. So I think it's good that you have put this one, and I think this one is a kind of umbrella of everything. So maybe you can add at least an arrow to the outcome and maybe other arrows to other variables. But
okay,
say that I think it's great that you have thought about this one.
Yeah.
okay, thank you.
I have a question. Can I ask?
Yeah.
Yeah.
I got confused with what you said, because you mentioned physical activity. I was also thinking about it, but then Priscilla said that we're only interested in those variables that are related to both exposure and the outcome. So physical activity, I don't see a path how it could be related to food stores.
No,
so then I wouldn't add it.
Yeah, I actually said that maybe it was not that important for this question, but I just...
Because it is definitely a variable that it's related to BMI, but not with food stores.
Yeah.
So then it would be useless to put it in the DAG, right?
Yeah, I mean, I can also think that always as a first exercise, you can include more things to try to represent the, let's say, the universe of your research question. And then, as Priscilla has said, you can like start to clean things, you know?
So you're thinking that your DAG is also like a framework of your research question as a wider thing, right? So you build first a DAG that could actually show all the variables, and then it's helpful for your discussion maybe, but not for building your model, right?
Yeah, this is actually a discussion that we had with Priscilla the other day. So, and we actually said that, well, I personally think that at the beginning, it's good to think about all the different elements. So as you said, maybe more as a conceptual framework, but then you can go more into detail, and going more into detail and representing like the specific variables is when you are able to identify those variables that you need specifically for your analysis.
Okay, thank you so much.
If you want to add anything to that, Priscilla?
I was just thinking about the physical activity together with the idea of ancestor variables, right? Because you can think of an ancestor variable that's something related to the urban design that leads to how food stores are distributed, and also leads to BMI through a bunch of other things, like, for example, the way that whether people exercise or not, or whether they have the ability to exercise because of the urban design. So it's sort of the discussion of this sort of ancestor variable that leads to both things, but sort of far away from what we want to measure. But it's also a way to think about this sort of broader conceptual framework that's not this kind of DAG that's looking at specific variables, but it's more like a conceptual framework of what the research question is. And like, how could you try to proxy for a variable like this, urban design? Maybe there are the city profiles. Maybe there are other variables that you can try to use to measure a proxy of this. And then once you adjust for it, then you're going to be able to close this path, right? Yeah. Unless it's actually a mediator, which in this case doesn't look like it's a mediator, because it's more likely to be urban design that causes the distribution of food stores. So.
And Andrea, I think you also said something that I think it's really good, that when you draw this more conceptual DAGs, thinking about those things that maybe you don't have measured, but you think are, they have an important role in your research question universe, let's say, it's good to have it, because when you already have done your analysis, you have your results, and you need to discuss your results, sometimes you can see in your DAG, or you can identify in your DAG some potential residual confounding that you are not measuring in your analysis, for example.
Right, that's quite important. It has happened to us in some articles that we have been writing. So I think that's really interesting to discuss.
Yeah, thank you.
Yeah, I just have one question more.
Sure.
I will have repeated measures from my exposure and outcome variable. Is there I need to draw my DAG in a different way because it's a longitudinal association, or in this case it's with you draw it, you don't have to put the repeated measures. I don't know. I don't know if you have any answer for that.
Yeah, so the interesting thing about, and you said in the beginning you were looking at how many years of?
I will have just three repeated measures.
So you're looking at changes in the density of food stores and changes in BMI.
Yeah.
So and then do you have BMI for those same periods?
Some of them. No, they're not the same periods, because BMI I have from 2002, the second one from 2005, and the third one from 2009. And my exposure variable are from economic censuses. And the first one is from 1999. The second one is from 2004. And the other one is from 2009. So it's not exactly the same period, but the data from food stores are previous of the outcome. Yeah, because there are different databases.
Because one thing that one way that you could also look at this is using this type of DAG that looks at food environment in period 1, food environment in period 2, right? And then BMI 1, BMI 2. So let's say you start with this measure of BMI, and let's say this predates your first measure of food environment. So you have, and then here you have a second measure of BMI. So you can say that food environment influences BMI at time 2, and also influences BMI, and also influences food environment at time 2, right? Thinking what you can do, maybe you can adjust. So if this is your exposure and this is your outcome, you can maybe adjust for BMI before the change in food environment. You know what I mean? So that now that's going to be a covariate. So that's now going to be a covariate because it's a BMI at different times they are associated, right? Because it's more likely to, they're like this, there are all these ancestral variables that make BMI be high or low in a particular neighborhood. So you know the BMI before, and you know the food environment now. So whatever change was between the BMI 1 and 2, in time 1 and 2, you can attribute to, you can measure the changes in food environment this way. Or maybe there is a food environment 0 here.
Kind of complicated.
Yeah, this.
So
Because remember when we talked about DAGs, we always have to think about this arrow, about the directions, right? So you have food environment 0 and you measure this change and you know BMI at 2 different times. So by measuring this association, adjusting for BMI in the past,
Okay.
BMI in the past could actually be a covariate in the,
Covariate.
yeah.
Okay, that sounds, okay.
Or
So
if you use your model, instead of measuring food environment and BMI, you just measure change in food environment. So your variables, your exposure variable is going to be change in food environment, and your outcome variable is going to be change in BMI. And then you can look at the other things as covariates.
yeah, well, I think that what is the better option, because I think that it's, well, I do not use my exposure and outcome as a change, so I will put the variables like one by one and then put it in a fixed effect model. So I think that the better way in a DAG could be in this way that you're explaining me. But I will draw a new one. So, and I will talk with my assessor. Yeah.
Yeah, so you're going to use, so it looks like you're going to use your observation nested in time, right? So time is going to be, in the sense that you have all the observations together, and you're just going to add a fixed effect for the municipalities. You said, sorry.
Oh.
Maybe we could think a little bit more about how you're going to measure, and if you're actually going to measure change, and if you're not going to measure change, how are you planning to look at that?
Okay.
In order to think about the DAG. But I think probably the previous version that you presented is better than this one. But it's just another way that you could also look at changes of things over time and how one thing influences the other.
Okay. Thank you.
You're welcome.
Let's go for Carolina. Is Carolina here? Yay!
I'm here.
Yay. Okay.
So I missed the beginning, but you're going to put up my DAG up in the screen?
Yes.
Okay.
And then I'm going to ask you to talk about your research question.
Okay.
And your aims, so that we can all get sort of at the same time.
Okay. So the main aim of this study is to understand whether the built and social environment where pregnant women live during their pregnancies is associated with their baby's outcomes, no? Specifically birth weight and potentially gestational age, and potentially a combination of both. But I'm seeing whether the data supports a combination of both. That's why that's not entirely clear. So there's again, like in all SALURBAL papers, the exposure variables are at the neighborhood level. And in this case, because I'm using data from a cohort from the city of Cuernavaca, it's a cohort where women are recruited when they're between 16 and 20 or 18 and 22 weeks pregnant. And they all live in the city of Cuernavaca. So there's about 7 municipalities that have participants, but they're mainly clustered within the like most urbanized 2 municipalities of the city. So, but the good thing is that we have the exact coordinates for their homes, so we can construct these variables for the buffer around their homes. So the 4 exposure variables that I've illustrated here in the DAG are: 1, the density of fruit and vegetable shops, in a buffer around their homes. The second is the density of chain convenience stores, which are, I'm sure, I don't know if Jenny explained at the beginning, but we have this like 7-Eleven, and there's a big chain called Oxxo here in Mexico, which sells mainly on healthy foods and beverages. And then I would like to construct an index for the built environment, again, around women's homes, which would include variables on the proportion of blocks around the woman's home that has a sidewalk, that has public lights, and trees or palm trees, so sort of green. We have those variables already constructed there from the census. So an index to sort of, that I hope would be able to classify neighborhoods into sort of a better built environment and a worse built environment. I don't know how that's going to work, but right now I have the variables separate, not in an index. And then the other one is the marginalization index, which is the same as Jenny will be using, which is an index composed of 10 different variables, including education and some sort of more material characteristics of the home and the neighborhoods. So the hypothesis is that, I mean, the food environment variables will be associated with birth weight through a mother's diet. And then obviously fruit and vegetables through, you know, better diet, and convenience stores through consumption of ultra processed food, so in a negative way. The area built environment would be associated with birth weight through mother's physical activity and also mother's stress, so more psychosocial pathways to do with hormonal and physiological changes, about feeling unsafe and living in a neighborhood that has no, you know, that's really dark at night, and you might worry that, you know, you get mugged or something. And a marginalization index, again, associated with birth weight through mother stress, again, psychosocial pathways. And then I'm going to tell you how I got to here. So I made a first list of covariates. And I guess I was thinking more of a traditional definition of confounding, no? So variables that would be associated with the exposure and associated with the outcome, but not in the pathway between exposure and outcome. And I decided to leave. When I drew that DAG, I realized that according to the, you know, the structural definition, they wouldn't really classify, most of them wouldn't really classify as confounders. They would be more mediators. And I don't know if I had to take them out or leave them in, and because it was a class, I decided to leave them in just to see what you thought. So that covariates that came out as like real confounders, I guess, was mother's age, because mother's age, because, you know, yeah, a person can choose where to live according to their age. Yeah, that was the rationale, and there is quite a bit of evidence about birth weight and mother's age. And then household wealth associated with area level marginalization and with birth weight. And down here is mother's education. And then the ones that I thought would be confounders was mother's smoking, but this seems to be more of a mediator, I think, and mother's chronic diseases. So these would be, I mean, the arrows from the exposures go towards these variables and then towards birth weight. So they don't meet the confounding definition. And then pre-pregnancy BMI, which is down at the bottom, which also, I mean, pre-pregnancy BMI can be associated, can be, you know, linked or caused by the neighborhood, food and built environment, and also is associated with birth weight. So that's that. It's a bit convoluted.
Oh, I liked it. I like the fact that you thought about the mediating factors. Again, it's always good to think about the causal mechanisms so that we make sure we don't adjust for them. And I think that is very interesting the way you thought about maternal education and age, because when I think about these associations, I think more from the perspective of like, when do you become a mother instead of where do you choose to live, right? So I would say that, for example, area marginalization might have an association that's actually on this direction with mother's education. Because if you live in a marginalized, and you're saying that this is an index that also contains education itself.
Yeah. So it's at the area level, what put it in the index, and this would be the individual's education level. Yeah.
So if you think that where the person lives, right, influences the education that she might have in the future, or the education level that she might achieve. Sorry, I'm trying to do the opposite from this to this, right? So this was actually going to be a mediator too. And if you think that mother's education actually influenced the age in which you decide to become a mother, then you would have another pathway, right?
All right, yeah.
So
I did not discover how to make the arrows curvy, so
it's a little tricky. So that I would think that this is something that also makes sense, right? So going from the place where you live influences the education that you get, which influences the age in which you decide to become a mother, which influences the birth weight. So maybe deciding which one you should adjust here, because since you already have education in here, maybe adjusting for mother, it's really the thing that you need to adjust for, and not adjust for mother's education, maternal education on top of that.
Yeah, you're right. I mean, I thought about these with like household with mother's education and mother's age, like self-selecting into neighborhoods, and that's, you know.
Yeah. On the other hand,
was pointing, but you're right.
On the other hand, you don't create any biasing path if you adjust for both, right? Like, let's say that you adjust for mother's education and you also, just in case, adjust for maternal age, you're still fine. You still have your main pathways here, right? So it's like, it's not your minimal set of confounders, but you want to, like when we show the examples, right? During the first session, we talked about you might adjust for this, you don't need to adjust for, but you might decide to adjust for just because you want to include the variable because it's just something that people do in the literature. You want to include maternal education and mother's age. And you know from your DAG that they are not colliders, so you can adjust for them and it's fine.
Okay.
As long as they are not in the pathways of these things.
Yeah, that's clear. Okay, but that's
Another thing that I thought is that you have these things that might also have arrows between them, right? So I would say that area marginalization also has an arrow between this and maybe density of convenience store.
Yeah, for sure.
You want to add? So if you adjust for this, right, you'll be closing one pathway. So maybe like my general suggestion about this questions that look at many exposures is to think about which is the one you're really interested on.
So say that again. If I include the 4 variables in my model, but there's this arrow, that what am I doing?
So if there is this arrow here, right, and you adjust for this, you're adjusting for a mediator on this path.
You're right. Okay.
So you really have to think about maybe trying to reduce the number of exposures that you have and think about the ones that you're really interested on. Because if you're really interested on density of convenience store, it's okay to adjust for area marginalization, because area marginalization is going to be a confounder in this association.
Yeah.
Right?
Okay.
So like just think that this is no longer exposure. Is just something that you adjust for now. You're just closing a biasing path, right? You're just closing this path here, but this path is still okay. So you're still measuring the effect of area density, area convenience store density on birth weight. But if instead you think that this is an important exposure and this is not,
yeah, then I have to.
You're closing this pathway, which is a mediator pathway between area marginalization and birth weight.
Okay. Yeah, I hadn't thought about that. Thanks.
So these two probably are also sort of related in the sense that because these are proportionate, I am understanding, no? If they are proportion of food and vegetables and proportion convenience, they like as one goes up, the other goes down, but here is density, but still there might be association. You might still have an association in the sense that if you have more of the one, you might have less of the other.
Yeah, actually, that's a good point. I could actually construct a ratio between the two of them and have a single variable, which kind of takes into account both healthy and unhealthy. Like, it can tell you whether it's, you know, if it's, the problem is that they will all come out as, there's many more fruits and vegetable stores than convenience stores. So all of them will show like there's a higher ratio, but there will be variability. So
yeah.
That's something to
actually,
consider.
I was going to ask you a bit about this because I feel that this proposal is very exploratory, right? You are looking to, let's say, 3 dimensions. You are looking for food environment, built environment, and social environment, let's say. And yeah, and the first question that came to my mind looking this DAG was like, okay, but why there are 2 variables regarding to food environment and then 1 for built environment? Because actually you were saying that you are going to create an index of built environment with a lot of many different things, because you talk about greenness and then you talk about, I don't know if you said like something sidewalks, and then you talk about lighting. So it's also a very broad construct. So I was wondering all the time why you differentiate those 2 variables of food environment. Maybe because you are more interested in food environment. I don't know.
Because it's a bit of a, no, you're absolutely right. I should actually go. I mean, up till now, I've always used them separately because they measure different things. Okay, so in the work that we've done previously, we've used fruit and vegetables, convenience, supermarkets as different things because they're very different. But in a way, in this case, where I want like a single variable that measures the food environment, it would be pretty easy to combine the 2 variables because I have the actual number of stores in the 800-meter buffer of each kind. So it would just be a matter of creating a ratio or a proportion of, you know, convenience out of the total number of stores or something like that. It wouldn't be too difficult.
Yeah, I just wanted to say, because it sounded like I really don't know, like you are the expert. So if you tell me that they are different and you need to measure them separately, it's okay to do that. You don't have to create one only exposure, but maybe you need 4 DAGs now.
Okay.
Because you need 1 DAG to see, just look at this as an exposure and the others are confounders. Then you look at the second one as an exposure and the others are confounders. And the third one as an exposure and your others are confounders. So that to examine whether you are closing any pathways that are on the, you know, for each one of them, then you do a separate evaluation to see whether you are adjusting for mediators.
Okay, and in that case, you would run separate models, obviously.
Yes, and so in this case here, let's say this is the model that you want to look at area density of fruits and vegetables. So this would be a covariate, and this would be a covariate, right? This would be a covariate. And so you're just looking at one. You look at one at a time just to see how it looks like. And so it's very clear here. You're looking at density of fruits and vegetables, and you're seeing all the mediators and all the confounders. And you can decide which ones you should adjust for. And then if you want to look at area marginalization, then you change the other ones and leave area marginalization as an exposure to see if you're closing any pathways.
Okay, yeah, this makes a lot of sense.
Yeah, and personally, I think, well, I come from environmental epidemiology, so I'm a big defender of multiple exposure models. But of course, there are many different ways to do things. I just think in this case, you are looking like, for me, the way I understand it is 3 domains. So yeah, just to really see and decide if you really want to look to all of them together, or you really want to look them separately. Like, for example, in SALURBAL, in general, what we are doing is that some papers are looking built environment and some papers are looking social environment. And there have been proposals that have put both together, but then they have decided to separate because those are big dimensions. So yeah, just think about it. I mean, it really depends of the main aim of your paper or proposal, but yeah. And I would like to add another thing. I think that the exercise that you did thinking about mechanisms, it's great. And personally, I think this is something that we always should do, as Priscilla has said, to make sure that we don't adjust by them. And for me, when I saw this DAG coming from environmental epidemiology, I missed one mechanism that for me it's important, it's air pollution. In this case, it would be a mechanism from built environment to birth weight, because there's a lot of literature that associates air pollution.
Yeah, I did think about it, but the problem is because they're all in Cuernavaca, I wouldn't have any, you know, like variability in the measurements. You would have one, maybe 2 monitors, and I know you can do some sophisticated, can't remember what it's called, but you know, calculations for it for more like a smaller area air pollution, but I don't think it would work here because they're very concentrated in city.
Well, again, I mean,
reason. Sorry. No, yeah, for including more dimensions, no, because it's a small study, and in a way, you know, we've wondered whether it fits well within SALURBAL or not, because I'm not using any SALURBAL data. This is all data that we have for Mexico. But in a way, it kind of it adds to some of the studies that they're doing in the MAPECA group and the child health and maternal child health, because many of those associations sort of lack this more, you know, detailed analysis of potential, you know, pathways or so that's why, you know, I will submit it as a proposal to SALURBAL because I've discussed it with Anna, but it's a tiny sample in a single city, you know, it needs a bit more punch, otherwise it would become a very, very, very small analysis.
Yeah, well, at the end, as we were saying before, the idea, it's mainly when you are thinking about your research question, just try to draw the universe of your research question, the different things that are in the literature saying that are important factors. So yeah, as you are having a lot of different things, I think it's understandable that some things you decide not to put in that, but at the end you decide maybe to separate and just look built environment, for example, in birth weight. I just think it's important to include air pollution in your DAG because it's an important factor in terms of
course.
Yeah, I just added air pollution here. And then air pollution, I said that it's related to area marginalization and it's related to birth weight, and it is a confounder. And built environment, you can also think that is associated with air pollution, right? And so it's another biasing path here. But only if there is, like you said, if there is variation in that, right? I guess if there is not, then everybody would be exposed to the same levels of air pollution.
Yeah. Well, just think about it.
I will. No, this has been really useful.
Anything else? Anybody has any question about this DAG or something to comment or discuss? not, we can go to discuss Ceci's DAG. Okay. Let me see, I have Ceci's DAG here. Share my screen. Do you see my screen?
Yeah.
Good. So Ceci, do you want to talk a bit about your DAG and your research question?
Okay, so the proposal is more general, includes more outcomes and exposures. However, for this homework, I decided to just choose one exposure and one outcome. So the main research question, if in general, if there is an association between city-built environment or sub-city-built environment characteristics and obesity or diabetes. That is the general one. However, for this homework, I just working on in the question that is there an association between connectivity measured as street connectivity or street density and obesity. So these variables were chosen as a proxy for physical activity. However, we don't have that variable available, so I have that variable as a latent variable. Additionally, we have age, gender, and education level at the individual level, and we would like to adjust for this variable because of the epidemiology theory that is behind this. And additionally, we have population density in built-up areas, and this is a covariate because we have seen that there is an association between street connectivity or street density and population density in built-up areas, and also this could affect obesity because there is an association also between these two variables. Also, we have a social environment variable that is at L2, and this is the one that is that talks about population educational attainment. So education level affect this variable, but also the population density in built-up areas, because you can, depending on your educational attainment, you can somehow choose where to live if you live, or not choose, but can affect where you live, if you live in more dense areas or less dense areas. And I think that's all for this exposure.
Okay, good. I have a few comments. Well, a comment that it's not possible to see here, but in your document, I identified that you were saying that you were going to use street connectivity as intersection density, but here in the DAG you put street density. I just wanted to highlight that those are two different variables in SALURBAL, just in case you don't know. Both variables are used as proxies of street connectivity, but those are different. Okay, intersection density is where the streets intersect, so how many intersections you have, and density is more about the numbers of the streets you have. Okay, just I wanted to say that, and for anybody else in this call that is planning to use these variables or something, just be aware of that. So in general, what is recommended is to use intersection density because there's more literature related to this variable than to street density. Okay, I just wanted to say that. So yeah, so going to like the DAG itself, I'm going to unadjust the different variables that you have adjusted for, so we can clearly see which are the biases passed. So the way this DAG is done, we can see that actually age and gender are not confounders, are just ancestors of the outcome, right? But you were saying in your explanation that anyway you want to use those variables because let's say that classically those are variables that have been used to adjust, right? Okay, this is, I mean, I think in general, this is a good argument. We also, in the session one, also Xavi asked about why, for example, in the example that I was using with built environment, why I put an arrow between age, gender, and education, and the built environment variable. So, oops, sorry. So, yeah, I mean, I think personally that those are variables that can be approached in different ways. So you can think just, okay, generally we just adjust them because in EPI we think that age, gender, and education are variables that are important and we just by definition adjust them. But you can also think about the fact that, for example, depends of your age, of your gender, you are going to have a different interaction or a different use of the environment. In this case, the streets, for example. This is just a different way that you can think about it. Just, I wanted to mention that. And then in this DAG, for example, you've been more focused actually in, well, more like in the variables that you have, right?
Yes, I was thinking, or well, I read about other variables that could affect street connectivity and also physical activity and then obesity, but I don't have them, so I could add them as latent maybe.
When I was looking this DAG, I was just thinking that, for example, more about other ancestors of the research question. As we saw in the previous examples, for example, I think it was Jenny's example that she was thinking about geographic region or things like that, like bigger ancestors of your question that you could include here. Like, for example, city, because you are going to use, in comparison with the previous examples were focused in one country, but you are going to use many different cities, right? Mm-hmm. So you can also think about like a big element, which can be just city, for example.
Okay.
And just think, okay, so a city, just in the city it is, from the country it is, with the geographical characteristics that it has, is going to have a certain street connectivity, going to have a certain prevalence of obesity, and things like that. Okay. Yeah, something like this. And then other things that for me are maybe lacking here is again what we have been discussing. So the idea when you are thinking about your research question and the many different things that you can include in your DAG is this idea of thinking about the universe of your research question. So okay, before going, I'm gonna ask you something. So you said that in this example, for this exercise, you only input street connectivity, but you are planning to use more exposures, right?
Yes, but all of them are going to be individual. That's what they recommended me when the group checked the proposal. So I was going to have a final model with all the variables that contribute to the model. However, I was suggested, or someone recommended me to use just one exposure for each model.
Okay. 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 So, for example, population density is not going to be one of your exposures?
No, it's a coverage.
Okay.
But I also think that we somehow at the end should have
It's
one
okay.
model because all exposures don't go alone. They
Okay.
go how.
Okay, it's fine. Okay, so going back to what I was saying, the idea again is that try to think about all the different elements or factors that can be part of this research question. So when you are using an exposure like a street connectivity or intersection density, whatever, but the idea is street connectivity, you are thinking about many different things. The street connectivity is related to physical activity, as you already put here, but can be also related to air pollution and can be also related to noise, because the street connectivity is a way that, okay, people can walk more, but it depends how the streets are. You can also have more cars or more density of cars too. So
Also depends on the quality of public transportation.
exactly, exactly. So there are many different elements here that I think you could also think about. Maybe at the end they are not that important for your research question, but I think it's a good exercise for you to just think about all these different dimensions. And so having said that, I'm gonna share with you, there's a publication, and this is also something that for more people who are going to do things about built environment, I don't know if you can see that I put a paper in my screen. Do you see that?
No.
No? Okay. So there's actually this publication. I don't know if you know it. It's a kind of conceptual framework that always relate the urban design with environmental pathways like air pollution, noise, temperature, and then more individual pathways like mental health, social context, and physical activity. So I can share this publication with everybody in this group. And I think it's important to always, when you are doing analysis related to urban design, think about these different elements. Because especially the environmental ones are really related to transport and urban design itself, okay? So I will share that with you. And yeah, what else I wanted to say? So yeah, for example, you could just add here things like air pollution, noise, for example. Your case is obesity. Let's leave it with air pollution now, because I'm not so sure about noise. But you could put here and leave it, yeah, leave it as a mediator in this case. Oops, sorry. And what else I wanted to say? Yeah, and I have, I don't know if you want to say something, Steffi, about what I'm, or anybody else about what I'm saying? No? Okay. So, and I just had, for example, I have a question, it's a very small question. Why did you put an arrow between, this is individual education and this is more like neighborhood or sub-city educational level? Why did you put this arrow from here to here?
Because the educational level at the individual level is included in the calculation of that index.
Okay. Okay. Okay, I'm not so sure about this.
Yeah, this looks like the same, similar to what I saw in the previous example, which is education level is included in the neighborhood level measure, and it's also included as an individual level variable. And I'm always I'm not sure that it goes from individual to group. It's more, I think, to me, it sounds more like it's the other way around. It goes from the social environment, right? The social environment influences the opportunities you have, and is going to influence your individual level education?
The first one, the individual educational level, was measured like, it's like a previous information. It's a long time ago information. And I think social, no, no me hagas, no.
Yeah, but I think here, Ceci, the thing is that you are thinking maybe more about the variables than the concepts. And when you are drawing your DAG, you really need to do, like, kind of clean your mind. Don't think about the variables you have. Think about your research question. So your research question, you wanted to see if a street connectivity is associated with obesity. And having this question clear in your mind, just taking into account the things that you have read and things that your co-authors know because they are experts, and anything, you put all the conceptual knowledge in your DAG. And then once you have your conceptual idea, you think about your variables. And you think about if what you are putting in your DAG, it's already measured or it's unmeasured. If what you are putting in your DAG is just a very far away concept that you are not going to have ever in your life, but it's a far away concept that you wanted to take into account, like what we were saying, like historical background or, I don't know, cultural differences, things like that. And yeah, and but I think some of the magic of DAGs is that you are able to draw the ideas behind your research question, and you are able to translate this in something practical for you in order to define your analysis plan. I don't know if I'm too abstract right now.
No, I get it.
Okay.
I think what I've done is narrow because of what I know I have.
Yes, but
because of that information.
So I think now it's a good exercise. So first you have thought just about what you have and what is, let's say, practical, but you should now maybe put a bit more thought on it and think about more as a concept instead of the variables that you have, and think about more about other things that you haven't included before and maybe you should include. And after that, then do the exercise of like
drawing.
Find a bit more, thinking about your analysis plan.
Okay.
Okay. I don't know. I don't have much to say right now, honestly. I don't know if there is anything else from anybody else. No? Let's go to Xavi then. Xavi, you're here, right?
Yeah, sorry, I'm having a problem with my connection, but yeah, I'm here.
Okay, good. So we are going to look Xavi's DAG. Okay, Xavi, do you want to explain us a bit your research question, your DAG?
Yeah, so the paper tries to explore the association between the city level average travel time at peak hour and the individual odds of obesity and diabetes. So the two research questions is if there's an association between city level travel time and obesity at the individual level, and if there's an association between city level travel time and individual odds of diabetes. And the main pathways there would be through individual time spent in vehicles, meaning that if you live in a city a larger city and a more congested city, let's say, where the average travel time for that city is higher, you're more likely to spend more time in your vehicle. And that has a relationship with your individual physical activity levels on one hand, and the individual time that you have left to have healthy habits, and in this case, to be able to prepare some healthy food, right? So you have your individual food intake. So that would be like the main pathway. But I think that the interesting thing about this proposal is that it also wants to consider that there's other pathways between the city level average travel time and your individual odds of obesity and diabetes, meaning that only by the fact of living in a congested city or in a city where the average travel time is larger or longer, you might be more likely to be obese or diabetic, considering the mediators that you have on the top of the DAG, like risk of being hit by a car, transport-related noise, and transport-related pollution. So we would have like an individual-based pathway and like a social or sea-level environment pathway. So this is like the general picture. I don't know if it's worth it to go step by step to explain each of the relationships, or if you want to comment on some of it. I could go to comment each of them if you want.
Yeah, go ahead.
Okay. So for instance, so starting from the end back, you see that my main outcome is, so the other way around, starting on the individual odds of obesity and diabetes, you would have that these are mainly related to individual physical activity levels and individual food intake.
Mm-hmm.
They are also related to some individual characteristics, mainly biological characteristics. And then you would also have the city level covariates, such as the risk of being hit by a car, transport-related noise, and transport-related pollution. In terms of physical activity, you would have that the main things explaining or related to physical activity is first the individual time spent in vehicles, your individual characteristics as well, and others such as the built environment, also pedestrian accidents, pollutions, presence of public transportation, gas price, and so on. So these 7 characteristics. In terms of individual food intake, it's both related to individual time spent in vehicles, but also on a more general level related to the city food environment. And individual characteristics, of course, in terms of preferences and habits, and also purchasing capabilities. In terms of the city level, like bets, such as the risk of being hit by a car, that would be related to both city level average travel time, because that means more cars on streets, but also the built environment. So certain features of the built environment make you more likely to be hit by a car. Transport noise, mainly in this case, in this DAG, is mainly related to the average travel time during peak hour, which again is, I understand it as the number of cars being on the streets on a daily basis. Pollution, it's both related to city level average travel time, but also the built environment, because in this case, there are certain features of the built environment which can mitigate the effect of air pollution. In this case would be not only urban form, but also the availability of green spaces.
Yeah.
And then the key exposure, which is average city level average travel time. In this case, I think this is related first by the city motorization level, so the amount of cars that you have on a given city, but also to the built environment, because certain built environment features can be related to the fact that there's more cars, so that it takes longer for you to get from A to B, depending on how streets are designed. And also, and the main ancestor of all of this is the city size. If you live in a larger city, the average travel time to get from A to B is longer. In terms of city motorization level, it's both related to the city built environment, the city size. So again, a larger city implies more cars on streets. The presence of public transportation. So if there's no public transportation available, that means you are more likely to need a car, and therefore it's more likely for that city to have more cars on streets. The gas price, similarly, if you live in a city with a higher gas price, that means that it's less likely for people to purchase cars, so less cars on streets. Social environment also has a relationship with city motorization level, meaning that a more prosperous city is more likely, and this is based on literature, a more prosperous or a richer city is more likely to have more cars. What else? In terms of the city food environment, I think that is related both to the city social environment. So a more prosperous city is more likely to have better access to healthy foods, but also it's more likely to provide access to healthy foods, and also the built. So there are certain features of the built environment which are also related to the food that is made available to its citizens. Let's say that a more car-oriented city is more likely to be providing food through the channel of like large supermarkets or malls, which in general are less inclined to provide healthy foods. In terms of public transport, so I'm now going to go to the city level confounders. So in terms of public transportation options, it's both explained or related to city size and also social environment of that city. City gas price is mainly associated to both city size and also social environment. And lastly, I think I'm not leaving any of those out. I think lastly, the individual characteristics are mainly related to city social environment, mainly related to the access to a car. So if you live in a more prosperous city, you're more likely to be able to afford the car. That would be the association there, or the potential relationship there. So you see here that I'm adjusting by city built environment, presence of public transportation, city gas price, city social environment, because they are both related to the exposure, which is city level average travel time, and the outcome through all of different mechanisms. And then I'm also adjusting by individual sex, age, education, and access to car, because I think they are important for the outcome, but this is a question that I have for the group.
Yeah.
I think I would be also doing it correctly if I didn't adjust for it, because it's not related to the exposure. So this was maybe my main question for the group. So I think maybe this is too exhaustive. I don't know, but that's my main question about the individual characteristics at this point.
Okay, Tavi, great. This is a very thoughtful DAG, and you have explained it perfectly. Yeah, actually. Well, first I wanted to comment that I like that you actually thought about the environmental mechanisms that I was commenting before, like you thought about air pollution, noise, you also include pedestrian accidents, so I think that's great. And yeah, actually one of my main comments was going to be regarding to these variables, right? Because the way you have drawn this DAG, it seems that it's not necessary for you to adjust by these variables. But yeah, but as I said before, you have different ways to approach this. So one, you can say, okay, at least sex, age, education are like the classical confounders of epidemiology. So we generally just think about them by default. But another thing that I was thinking when I was looking to your DAG, and we can discuss about this, I was thinking, okay, but when you are thinking about individual sex, age, education, and also access to a car, this can lead also to unmeasured variables that can be transport behaviors. For example, And you can think, okay, so it depends of your age, of your gender, of your education, and if you have a car or not, you will have certain transport behavior, and this can be also associated to travel time. Correct me if I'm wrong, or what do you think about this reflection?
Yeah, I agree with that. But in this case, I thought it was captured by the arrow that goes from the individual features to individual time spent in vehicles, because the key exposure, it's like the average travel time at the city level. So it's not like the amount of time that the individual that I'm analyzing is spending in a vehicle. So that would be that circle where you have the pointer at. So do you understand my point?
Yes.
So what I mean is that your individual.
I guess when I think about, I think this is a great discussion. When I think about transport behaviors, I don't only think about time spent in a vehicle. I think more in general terms, like what kind of transport behavior you have in general, if you mainly walk or cycle, or you use public transport, or you use a car. And it depends of what are the transport behaviors. You will have more or less travel time because you will have more or less cars in the city. I don't know, I was thinking more about this.
Yeah, I think that the tricky part for me as well about this design is that sometimes it's hard to see the difference between the behavior of the specific person that I'm going to be analyzing the odds of obesity and diabetes, and the features of the city they live in. So in this case, what you're mentioning, like behavior and attitudes and decisions like modal choice.
Yes.
I'm having a hard time understanding like where that arrow should be pointed at their individual time, because so given like taking your example, if you're more inclined to use active modes of transportation, so what does that mean in terms of time, which is what I'm measuring here? That means that you as an individual are going to be less likely to spend time in a vehicle, but you alone, like you individually. So how would that translate into the city level exposure? That's what I'm having a hard time myself thinking about it. So
I had the same question when I looked at your DAG, because I would think that, so if I think from individual level variables, right, or things like behaviors will influence the time spent in a vehicle, and that it will in turn influence the average travel time of the city. It's because it's the sum of everybody's behavior that makes the average time rather than the other way around.
I agree with the question, and I don't have an answer yet because
I mean, part. I totally understand your point, because it's about the different levels at the end.
Yeah, it's always difficult to make this when you have different levels. But I like the way that he thought about each one of them separately, and like city levels and sort of high level variables, city level variables, and individual level variables. I think that's a very helpful way to think about sort of multi-level models like that, and think how to build on each other.
Yeah, but I guess when I see your variable about individual time spent in vehicles, I think I'm always thinking more about actually the people who are in cars in the middle of the road being affected by the peak time, by the travel.
Yeah.
Right?
Yeah, so that would be that green arrow. Like if you live in a city where the average travel time from A to B during peak hour is larger, you are more likely to be more to spend more time in your vehicle. But
I see.
I think that not only those that are inside the vehicles, so the individual odds of citizens of being obese or diabetic are not exclusively restricted to those that spend time in the vehicle. So only by the also by the fact of living in that city, if that city has more cars on streets on a daily basis for a longer period of time, that has other implications, like indirect implications for them, which is the three circles, the gray circles on top of the DAG.
I understand now, and I think it makes sense that transport behaviors will influence travel time in peak hours, and that will influence individual time in vehicles. I remove my previous comment that I think it's the opposite. I think this way is the right way.
Okay, so you would include this, the transport behavior circle between individual characteristics and average travel time, or?
It's interesting just to explain the mechanism, but we don't need to adjust for it, right? Like, because it's a mediated, if we adjust for individual age, sex, and access to car, we are already closing that path. So it's interesting from the perspective that tells you the mechanism, but we don't, it looks like you don't need to adjust for it if you adjust for individual age, sex, education.
Yeah, so
okay.
You know what I mean?
Yeah, the reasoning to include this was to try to explain why you could think that it's important to adjust by these individual characteristics, because this was not there before.
Yeah. So the question that I still have is, in this case, what we are saying is that one individual's characteristics has a relationship with the city level average travel time.
Yes, because
so,
sorry.
No, my question was, like, I understand that the travel behavior of citizens have an effect on the average travel time, but so in that case, that arrow should be maybe pointed from the city social environment, not the individual. So that's my thing, the difference between the individual, so one person, and the social characteristics. So let's say that if you have a higher social environment, or like a population with higher education rates and higher income rates, that means that they are more likely, given the literature, they are more likely to be prone to use active transportation modes, let's say. So that would have an effect on the average travel time for that city.
Yes.
But not at the individual level.
I think it's correct to have both arrows, because you can think of like the sort of the city level built environment will have an effect on everybody, but your individual level variables will have an effect that is independent. Like, you might live in a city that it's like has a lot of public transportation, and the average people go and take public transportation, but you might not like it. So it's going to affect you independently of the city behavior, right?
Okay, I see. Yeah.
I mean, I think at the end, there's no right or wrong.
Yeah.
Because just because your outcome is individual level, just because you're looking at odds of obesity, just because of that. If you were looking at obesity at the city level, then you wouldn't need that individual.
Okay.
Yeah.
Okay.
Yes, can I add a point?
Sure.
Maybe it can help us to think in a slightly different way. I think his how can I say it in English? Angustia. His concern. Yeah, he's anxious. His concern is because the main exposure is in the contextual level, and it's not seem very very right to adjust for individual level. But if we think there are two or more different independent effects explaining the relationship between your exposure and your outcome. Yes, of course, the average of travel time in peak hours is more related with contextual determinants. But we can think, even if we have the better public transportation system, restrictions about cars, many different policies in the built and social, or we have very well educated people to use. Besides this, we could think there is some individual behaviors, as I like it very much, Ioni, when you put these points, transport behaviors, because for example, in many Latin American cities, even if you have everything like this, people would prefer cars, because cars has a meaning. It's a social status, and it's not controlled by all the public policies we can think. So it's something like more subjective that you could explain by this way, and I think it contributes to average of travel time in peak hours, and it's also an independent pathway through your outcome. It's a way, I think it's good to understand better and to accept more the idea that a contextual exposure can be in part explained by individual characteristics.
Good, yeah.
Okay, yeah. So so you think that in this case it would be safer, as I was planning on adjusting by individual characteristics, right?
Yes, yes.
Yeah.
Totally, totally. And also Priscilla has done also a good point. It's also because you are measuring obesity in an individual level. It would be different if you do it only in well, not only in a city level, right?
Okay.
So,
Cool.
yeah.
Thank you. Yeah, this was really helpful.
Yeah, nice.
Yeah, can I ask one question?
Sure.
I was just looking at this pedestrian accident and obesity, and I can understand that there is accidents could be associated with individual level physical activity, right? Because I think more accidents would be. How do you think that works? And especially because you had two. We had one that was a mediating mediated by individual level physical activity, and one that was like a direct effect of accidents on obesity.
Yeah, this was a mistake, because I updated this after I sent it to the drive, but actually the straight arrow was like the direct arrow was from transport related pollution to obesity. And the pedestrian accidents was through physical activity. So I would be missing an arrow here from pollution to obesity.
Yeah, I was thinking that too.
That was just a mistake, and I corrected that afterwards, but I didn't remember to update it. Yeah.
It's more than fine. Yeah, and well, then I was this is just a small question. I mean, I think the most interesting debate here has already happened. But I was thinking also, why didn't you put an arrow between city size and city built environment, for example?
Yeah, so when I say city built environment, I'm referring to those to two specific characteristics. It's population density and intersection density.
Okay.
So I thought, well, you can have a small city which is really dense and with lots of higher intersection density, and you can have a large city with those same attributes. So that's why I didn't see a straightforward relationship between those two.
Okay.
Right?
Yeah. Well, I think, yeah, I mean, just thinking, yeah, I think it's a very valuable argument. I mainly think always like, okay, if you have a big city, it's more likely that you will have certain built environment characteristics. But yeah, I mean, what you said, it makes sense.
The question that I had with city size is that in a previous version of this framework or this DAG, or in a previous idea that I had for this paper, I was planning on adjusting by city size in the model, because I thought that, I don't know, that there might be a relationship between living in a larger city and having higher odds of being obese or diabetic, but I don't see that anymore. I think that the main relationship between city size and the odds of obesity and diabetes are already captured by the other confounders here. What do you guys think about that?
No, yeah, I completely agree with you. I think city size, you see here, I think, well, there are some biases here now. No.
But that's because you added transport behavior there.
Yeah, that's true. That's interesting.
Yeah, I forgot how my DAG looked like.
Yeah, it's interesting.
You have a path between social. Why did you add the path between social environment and transport behavior? Because, okay.
I think I just added because we said something in the discussion that it was associating social environment and transport behaviors. Like the idea that it depends of the culture of the place where you live. Maybe it's more promoted to have certain transport behaviors. And then related to individual. So it depends of your education level, you will have also some certain transport behaviors. But that's now.
I think that it is because transport behaviors, it's marked and unobserved, right?
Yeah.
That's because
there is a biasing path now between average travel time, transport behavior, individual time spent on vehicle, and food intake. So if you can adjust for any of those, then you close the path.
Okay.
Well, and it really depends if you think that transport behaviors is going to lead to a certain individual time spent in a vehicle, which actually I'm not so sure about it.
It could be just associated with the
average travel time in pickups. And then this is associated with individual time spent in vehicles. That makes more sense, I think.
What happens if you take out the arrow between individual and transport behavior? Could you just try that, just so I understand?
Individual, sex, age, education?
Yeah.
So actually, my idea of introducing transport behavior was to actually try to explain mechanism through which the individual characteristics can affect the average travel time in peak hours.
Okay.
You can think about it.
Yeah, I think I have to.
I think the discussion that we already have is.
But this is a good start. That's a good idea, I thought.
It's great. And regarding to your question about city size, I agree with you. I mean, I personally see city size more a kind of ancestor of the cities, but I think that what really affects your outcome and other outcomes, it's more like the specific characteristics of the city.
Yeah.
Okay. So, I don't know. I don't think I have much to say about it. We still have 14 minutes more. I don't know if you want to discuss anything else.
Anybody else?
Oh, sorry. I just have one question. How do you will measure city social environment?
Me?
Yeah, Shari.
Okay.
Sorry.
I use the social environment index.
But I don't know how.
It is an index, it's a mix of education and...
Yeah.
You mean Usama's index?
Yeah, I'm using Usama's social environment index, yeah.
Which variables are included? Because I don't know.
I think it was education level at the city level. I don't know, I can't remember.
Pipe water,
Okay,
I think it's education level, pipe water, sanitation, proportion of households with sanitation, proportion of households with overcrowding. There is the index that's already constructed if you go to the built environment data. Yeah.
Yeah, I think that it's some of my variable of marginality index. I think that it's similar. Okay.
Yeah.
Thanks.
I have a question.
Sure.
Just what would happen if you think, for example, that the average travel time affects actually transport behavior? Because that would happen for certain groups, right? For probably high SES groups, they can choose. Because the transport behaviors, Ion, you mentioned transport behavior like a mode choice?
Yes, yes.
That's what you meant with transport
Yes,
behavior?
exactly, yes.
The modal choice.
Yes.
Right. Then, yeah, travel time might affect actually modal choice rather than the other way around, or both. I don't know, what do you do when you have the arrow going in both directions? What do you do?
Yeah, so the thing with DAGs is that you should choose. I mean, the idea is you need to make a decision. You really need to think about what is actually your concept framework here. So yeah, so when I was thinking about transport behaviors or modal choice, if you prefer, I was thinking more about the capacity. So yeah, the ability that people have to choose one thing or another. So you're right that maybe also the average travel time can affect that, but yeah, but at that moment I was thinking more about the infrastructure that the city has in order to give you options. This is one thing, and then the tools you have inside yourself in terms of like your educational level and your ability to choose one thing or another.
Yeah, I think it makes sense that three things would influence transport behavior, right? Individual preferences, that comes from things like sex, age, and education, access to car. Average travel time, I think it could also influence the decisions that people make in terms of whether they want to use a car if they're going to be stuck in traffic for a long time, and also the policies, the availability of public transportation, right? So those are three things that sort of converge into transport behavior and make transport behavior be sort of collider in that, something that we really don't want to adjust for. So if that is the case and transport behavior is a collider, then we don't have a biasing path there.
I think this could be an eternal discussion.
I think I have to think more about this, because even though I understand your points, I'm still having a hard time understanding the difference between, or not the difference, but the relationship between the individual travel behavior, or let's say the individual modal choice, and the social modal split, let's say, which is something is at the individual level, what I personally do. And the other thing, a separate construct, is the city modal split. So I understand that the city model split explains the average travel time, because if there's more people using cars, it's more likely to be there's more likely to be a longer average travel time in the city.
Yeah.
But I'm not so sure about the individual model choice. But it's okay. I have to keep thinking about it.
It's a very hard one, I think.
Yeah.
It's a hard question. What you are trying to figure out is yeah, I think I'm going to be involved in the kind of same problem, and maybe we get to talk at some point.
Yeah.
Yeah, but just being pragmatical here, I just think that adjusting by individual sex, age, and education, just by definition, it's a good approach.
Yeah.
Just saying that.
In practical terms, I'm going to do that.
I was just gonna say that having a DAG like this is also, it's good to think about all the sorts of comments that you're going to have in your paper, right? Because then when you think about this really hard and you think about, okay, what's going to influence people's decisions? And you think about its average travel time, it's whether there are different modes of transportation, it's people's it's people's choice. And so if you don't adjust for that, you have a justification and say, oh, I'm not adjusting for that because that's actually a collider model. So when you have the review and the reviewer is saying, oh, you didn't adjust for transfer behavior, like, no, I should not adjust for, like, you have like a thought process that you went through just to really decide and say, I'm not going to adjust for this for X, Y, Z, instead of just say, oh, I didn't have the variable.
Yeah, you're right.
Yeah. And I think, I mean, this discussion about what goes first, like travel time or transport behavior or the other way around, it's like the eternal chicken egg discussion. And I think sometimes you just need to make a decision. What you, and for your research question, it makes more sense. And for me, and this is just because of my framework, maybe I would think more about that transfer behaviors goes first. And because of at the end, the congestion of a city, it has a very strong cause in how the city is designed and how the transport infrastructure is created. And this is first. And then generally, and this can also be discussed, but more diverse transport infrastructure you have and better quality you have, generally people tend to have certain choices in terms of transport. And then this also leads more or less congestion. That's the way I see it. But of course, this can be discussed. And I just think it's in terms of your research question at the end, you just take a decision. And I think, as Priscilla has said, if you have thought about it, you are able to discuss it, and that's fine.
Do you know what I would think? It might help sometimes if you see the determinants as the spheres of the social ecological model. So there are more proximal determinants and more distal determinants in this sense. I think transport behaviors that Jon added here and made this discussion richer, I think. It could be positioned closer to the outcome, and then it might be easier to think about some variables, but as a mediator.
Wow. We are just 4 minutes to cover.
I think we can just
wrap up. Yeah. Do you want to say something, Priscilla?
No, I was just going to say thank you so much for sending your DAGs and participating in the discussion today. It's always I always love this kind of discussions, especially when you look at different levels, because it's always very complicated to think about which one caused, if it was the individual who caused the, and how these things are associated. And So I just wanted to say that if you have any more questions, or for those who didn't send, who weren't able to send their DAGs, that we're still, I mean, I think Ione is too, but we're still willing to look at your DAG and provide feedback. Probably not this week anymore, but beginning of next week, we'll be able to send the feedback, individual feedbacks.
Yeah. Yeah.
If we take a little bit more time, that would be still possible.
Yeah.
Yeah, I mean, if you want to send us something and we are able to comment, yeah, there's no problem with that. Yeah. And
that's great.
I mean, you have done a great job. It has been a very, very interesting and rich discussion. And we just hope that this has been helpful for you.
Yeah,
and
really helpful, yeah.
Yeah,
Yes, thank you.
Yeah, thank you very much.
Yeah,
you.
that's great.
that was it. Yeah. And yeah, at the end, I just think this is a kind of eternal learning process.
Mhm.
And we can always discuss about many things, but DAGs are a good tool in order to organize your thoughts and take decisions and more thoughtful decisions about your analysis and also your results interpretations and things like that. So I don't know, I think we are done. And yeah, we will send you some feedback. And we will send you also an email with a survey. So if you don't mind to answer the survey, just for us to be able to improve in case there's a future opportunity to do something similar. And yeah, and I think that's it.
Thank you so much.
Thank you.
Thank you.
Great.
Have a good evening.
Take care.
Very helpful. Thank you.
Bye-bye.
Bye.
Bye, everyone.
Bye.
Bye-bye. Thanks a lot.
Bye.